what I think the VA has done that's a complete and utter fail is the mental health program. So you have the largest mental health program in the world nationally. Well, I think it's 13, 14, $15 billion a year. They can show no evidence, and I mean zero evidence, that veterans are getting better from the mental health care. And part of the reason for that is every veteran who deployed gets diagnosed with PTSD. You went overseas, you're not doing well, PTSD. That's the great big shiny red easy button. Boom, PTSD. Now we don't have to do anything for you other than give you a therapist, give you a bucket of psychiatric medications. And if you're not careful, you'll end up on 10, 15, 20 medications. That's no joke. I know I've met veterans frequently who not on that level of medications any longer, but were at one point. And the therapy isn't provided by people who necessarily know anything about the military, don't necessarily have any cultural competence. It's a phrase we throw around a lot in psychology. They don't know what does a Navy SEAL do. They don't know what does a Green Beret do. They don't know what people in any of the other combat arms do. And they don't even know that there is a combat arms separation from support personnel. Now, everybody put on a uniform, they served, they stood up for their country and full respect for that. But they don't all have the same experiences. They don't all have the same injuries. And the VA treats everybody the same. And there's this automatic assumption of PTSD and of trauma. You served, you're traumatized. You deny the symptoms of PTSD. Well, you're in denial. I get that a lot. Oh, well, I say, well, the operators I work with, very few of them actually have PTSD. They don't have the fear reactivity. They don't have the avoidance of cues that might remind them of their military experiences. And then they come back on that as well. They're just in denial.
How did you as you transitioned out of the VA, I'm assuming at some point, or you were having did you have a grand kind of disillusionment with the work you were doing, or was it a slow transition where you recognized that maybe some of the parts of the system you're involved in were broken? And how did you learn to think critically and not get caught up in the momentum of well, this is what I was trained to do, this is how we're going to treat it? Was that a long evolution, or were there some very acute moments that led to that?
I think there was an evolution in the mid-90s when I realized or noticed, and it was something that we all talked about, all of the patients coming into the PTSD clinic were applying for PTSD disability. And what we found was they were coming in, the veterans coming into our clinic, all were reading from the same script. Several things that were very prominent, that were very notable, was if you diagnose somebody with something other than PTSD, the patient would get very angry. They didn't want to hear that they had depression or general anxiety and not PTSD. So that's a red flag. They would often say, thank you, doc, I'm getting better or feeling better, but please don't write that in my medical record because I don't want to risk losing my disability, which is a rational perspective to have. And so I don't blame the individual veterans. I blame the system for creating an incentive to turn veterans into psychiatric invalids, which I think is just tragic, absolutely tragic. PTSD is treatable everywhere else in the universe. But when you pay people to be sick, how do they get better? And then, as I was publishing some research, series of studies starting probably in 1998 through 2005, showing high rates of symptom exaggeration or fabrication, we published a study in 2005 showing a very high rate of dishonest reporting of Vietnam experiences. So, it was a small sample. We took 100 consecutive veterans, got their DD-214s matched, which you can get through Freedom of Information Act requests. And we matched them up with what they told us. And the disconnect there was unbelievable. Only about, I don't remember the numbers, but it was somewhere between 25 to 30% matched up according to what they said.
Yeah, it's an interesting topic.
And from there, what happened was really interesting. And that became the reason why, ultimately, the main reason why I left was the VA didn't want to hear this. Shut up. I got investigated for that study. They did a witch hunt. They looked for every possible little I that I might not have dotted, T I might not have crossed.
They investigated you because you were looking into like basically fraud within the VA. They didn't like that?
They did not like that. That's right.
Why?
Well, so here, maybe this is the big point. There is a PTSD industry within the VA. You've got empires built around PTSD programs. You've got a network of national centers for PTSD that have, an ungodly amounts of money. They're congressionally funded, so nobody can touch them. And, and I worked with these people. I was not an outsider when I was in the VA. I was publishing a lot. I had federal grants. To this day, I just got a thing a few weeks ago from some organization that tracks research productivity, and my research on PTSD puts me, and sorry for the brag here, but in the 99.8 percentile of PTSD researchers in terms of the impact of my research and the publications. My point is, I was one of them, but this work made me not one of them. And so my mentor, who at the time was one of the top people in the field, he was a director of one of the national centers, called me on the phone one day and said, "Listen, you just submitted this paper," referring to this paper on the showing the dishonesty in terms of combat and military experience. He called me and said, and this would have been 2004, 2005. And he said, "You submitted this to the American Journal of Psychiatry, somehow got into my hands," which isn't supposed to happen unless he was a reviewer. He said, "You got to retract this. You got to pull it back. You can't publish this." Well, why? Because it's going to hurt it might put our funding at risk. It might put our funding in jeopardy. And I said, "Yeah, but it's legitimate research. It's an important issue." He goes, "Well, it's a small sample size." Yes, it is a small sample size, but it's a pretty damn strong signal, don't you think? And maybe that means we should take a lot bigger look at it. Eventually, that paper got published in the British Journal of Psychiatry, which is one of the top journals. American Psychiatry didn't publish it. So we went to the Brits because they don't have the same politics. They published it. It got a lot of national, international attention. So that's when the VA really got mad, because The Economist, Washington Post, New York Times, Wall Street Journal, like it kind of blew up, and they assigned a handler. So I had a PR handler who had to follow me around. I could not do an interview without getting permission first. She had to sit in on the interviews, and she had the power to strike a question that I was asked. She had the power to strike a response that I gave. And that's when I left. My mentor actually said to me, not only did I have to retract it, but he said, "If you don't retract it, your career as a scientist will be over." He said, "I won't throw you under the bus, but I won't be able to protect you from, the other forces that will be coming at you."
I feel like this general theme comes up a lot with, there are bigger things at play that ordinary people like us aren't seeing.
You can't see it.
And you're,
right.
You're alluding to PTSD centers, and I think probably Big Pharma has a
Big Pharma, and the PTSD industry that's embedded in every VA hospital.
And some of it probably was well intended at some point.
Sure.
If, a PTSD center, like that'd be like, okay, right on.
Absolutely.
And Congress funding it, like,
made sense in the 80s.
But it's like, man, when you peel back a few layers, and I love, obviously you exposed it with what you did. If you're stacking up a DD-214 with a guy who's saying he has all this combat trauma, and you're looking at it like, no, you didn't. And if it was enough, instances to have external validity for a study, like, why would they not be like, well, hold on, I'll stop this.
No.
We need to refine the SOPs.
Right.
When someone comes in to do their out processing,
which would be a simple thing.
We're going to have it. Doc's going to be like, okay, and he's going to be looking down and, oh, you were never here. You know what I mean? And instead, they almost want that diagnosis.
It's what we now understand as the deep state.
Deep state.
I didn't have that phrase in 2005. I didn't have that concept. But when you think about how much money was at stake and still is, it's the same. A lot of the same people, if not the same dynamic, are still in charge, and they're still providing the same mental health care, the same failed mental health care, and they don't want to be disrupted. So really what we're talking about right now in terms of, so back to me being king for the day, we got to disrupt the big pharma and the PTSD industry. They need to be disrupted.